everyone, welcome back to my channel. My name is Nori Wise and I've just received my step 1 score yesterday, and I want to share with you guys tips that I followed. Like, even if you start dedicated period from scratch, which I did, you still have a chance and you still can do it. I'm going to teach you how to solve questions and how to make your own study schedule, as well as some test day tips like what food to bring and what mask to wear, things like that. So to make this more legit, here is my score report. 265 is the 99th percentile, and I want you guys to believe that you can do it too. It's not because I'm smarter or anything like that. We all are smart and we all can do it if we put in the right effort. So the number one thing that I need to advise you with is don't let the cliches freak you out. There's a lot of cliches going around on social media that you have to do at least 3 Q banks to get at least 250, or that Zonky is the only way to do it, or that you gotta do UWorld twice or otherwise you're doomed, or all this is just things that will make you worried. And I didn't do any of this. I only did UWorld. I did not use Zonky. So I want you guys to not compare yourself to others. As long as you're using the high yield material, it's okay if you start too late or if you start from scratch in dedicated. So my number one advice actually is to do well in school. This to learn the thing the first time around, to learn it well the first time around is the best way to approach it. Some questions on the USMLE I've seen actually come from school material and were not mentioned in first aid or UWorld or boards and beyond. I only remembered them because of my school lectures. So don't listen to those people who tell you do not attend lectures or things like that. No, to do well in school and to learn the concept first time around is much better than to start learning new material in dedicated when you're supposed to be reviewing. So the USMLE Step 1 is a big test because it tests a lot of knowledge. So you need to have the right knowledge base, and not just any knowledge base. They wouldn't ask you about the origin of this muscle or whatever. These are low yield stuff. You need to follow or only focus on the high yield material. And number two, you need test taking skills, and these will be manageable through UWorld. So the high yield material, the one that everyone knows, are the UFABs. So you want to make sure that all this high yield material is stuck in your head for good. The only way you can do this is to reinforce with ANKI. Even if you're not going to use the ANKI deck because it's too big if you're starting dedicated from scratch, but you at least need to use the decks for each subject, like Duke Pathoma for pathology, things like that. I'm going to give them to you. So what is the point of ANKI in the first place? The point is repetition, really. It's all about repetition. So if I tell you today that like you start dedicated and you watched a video and Dr. Ryan told you hypertension is the most important risk factor for aortic dissection. And this, for example, imagine is the first time you hear this information. Now, suppose your dedicated is 3 months, for instance. After 3 months, I ask you, what's the most important risk factor for aortic dissection? And you've never reviewed this information all through the 3 months. You might remember or you might not. The thing with ANKI is they will keep showing you this card. It will keep showing you this piece of info all through the 3 months, so that in the end, by the end of dedicated, you have this in the back of your head. Now imagine this being done for all the high yield material, then all the high yield material is in the back of your head. You get the idea? So I'm going to rank the resources 1, 2, 3, 4. Sketchy Micro is a very nice resource for microbiology because this is mainly dependent on memorization, and you reinforce that with Lelnatakov deck. Yes, it is doable and you can finish it in 3 or 4 months as I did. Micro is not a very high yield topic on the real deal. I did not get a lot of micro questions, and sketchy micro is enough with the Lolnautica deck. As long as you keep doing it every day, even if you don't, it can be crammable in the end. Trust me, I crammed Lolnautica in my last 2 weeks, and it was enough. Number 3 comes boards and beyond. Dr. Ryan is gold. A lot of questions that he actually mentioned how they come, or that the real deal will ask you such and such in this particular way. This is exactly how questions come. Trust me, guys. Boards and beyond, especially cardio and renal. Please review the renal and electrolyte sections at least 1 week before your test. And he actually says everything that is in first aid, and so everything that he says actually comes up. And how do you make sure you reinforce what Dr. Ryan says? If you haven't started light year early on, you still have a chance if you do the SOS ANKI deck, and that's what I did. Even if you don't finish all of it, as long as you follow up with UWorld questions, it will reinforce boards and beyond. It will reinforce what Dr. Ryan says. I swear one question came in renal exactly as Dr. Ryan described it. So make sure you at least watch the renal and cardio videos. At number 2 comes the golden pathoma. Whatever comes out of Dr. Sattar's mouth is gonna come in your test. Trust me, guys. Pathoma will give you free points, a lot of free points. Remember that pathology represents the majority of the test. It's over 50% of the test is pathology, and everything in the videos and in the book are what are the highly tested concepts in pathology. So it's as if you are actually taking the test, you're actually taking the material that will come 100%. And how do you make sure you reinforce what you've learned in pathoma? By using the Duke deck. This is a short deck. It's not it's not even 2,000 cards, and you can do it in 3 months like I did. And literally this deck has everything that Dr. Sattar says in addition to everything in the book. And I swear, guys, one question came exactly the same, in same verbatim as Dr. Sattar mentioned it, and it wasn't in the book. Like, he said it, and that was mentioned in the Duke Pathoma deck. So the good thing about Anki is that in the cards you actually have the codes of the doctor that you wouldn't find in the book. And last but not least, the most important resource is UWorld. I will tell you why this is the most important resource. Whatever is highly tested on UWorld is highly tested on the real deal. Trust me, guys, use UWorld as a textbook. Soak in the explanations. This UWorld doesn't just teach you test-taking skills. It teaches you like a lot of stuff that are mentioned in the UWorld explanations aren't found in any other resource. They're not found in Pathoma, they're not found in Boards and Beyond, and they come up on the real deal. I got a question and I was only able to solve it because I read the explanations well, and this piece of information wasn't found anywhere else. So please do not skip on this great resource. Do not skip the explanations. Reading the explanations is very important because it can make a difference between why the right answer is right and why the wrong answer is wrong. One piece of information can change an answer, and that's what UWorld teaches you. The saying that most people actually advise by is that doing questions is the most important. And I'm gonna tell you an analogy to this. Like, if you are to run a marathon, is it better to keep reading books about how to run a marathon, or to actually run a marathon? That's to actually run a marathon. And so, for example, what's the best way to recognize a disease? The best way to recognize a disease is actually to see a patient. Why do we all know the symptoms of the common cold? Because we all got the common cold, right? However, this is not always feasible, right? Especially if you are a preclinical student who's taking their step one after basic science. And so the next best way is case simulation, and that is only possible through questions. And so I actually started UWorld slowly by the end of January, doing about 5 questions a day, which is really nothing, but because I was in the middle of like school, and pump it up to 40 questions at start of dedicated. Every day in dedicated, you should be doing 40 UWorld questions, timed and random. Random, all systems, all subjects, and timed. This is the best simulation of the real test. And don't forget to soak in the explanations. I'm going to show you guys now how you can answer questions properly. Question, whenever you find a question with labs, mostly the labs will give away the answer. So the first thing I need you to do after reading the last 2 sentences is to look at the labs. So the last 2 sentences say chest x-ray reveals a mass in the right lung. You saved me a lot of effort reading this whole question stem by saying that this person has a mass, which is most likely cancer. Which of the following additional findings most likely present in this patient? Had I read the whole thing from the start, I would have had a hard time trying to find the diagnosis, and in the end it was given already. It was already given. You get the idea? And then after you read the last 2 sentences, you need to look at the labs and highlight only the pathological findings. So a sodium of 120 right away is hyponatremic. So right away, right now, I think that this person has SIADH because of a mass, because of small cell carcinoma in the lung, even before I read the whole stem. This is what I did when doing the real deal, because it saves a lot of time in the end that you can go over the marked questions, the difficult ones. You get the idea. But I still read it in the end. Like, now I know this person has small cell cancer and he has SIADH as a result, and so I can answer the question, what is most likely to be present? Obviously not this. This will be pneumonia. Not this. This will be right heart, something in the heart. This will be the opposite. This is in diabetes insipidus. Apparent euvolemia is correct. No, this is the opposite of euvolemia, peripheral edema. And so I did answer the question just by reading the last 2 sentences and looking at the labs. But in order to reassure myself, I still read the whole thing. He's an elderly man, and he's presenting with altered mental status. He had cough, which is consistent with lung cancer, a cough of several months, especially that he has a long smoking history. You get the idea. He's confused. All this is because of the hyponatremia. You get the idea. So this only supports my answer, but I actually did answer the question just by reading the last 2 sentences and the labs. You need to divide your study schedule into 2 blocks. The first block is learning the material, assuming you've done nothing before dedicated, assuming you've not watched Boards and Beyond and Pathoma before dedicated. So this block is mainly focused on learning the high yield stuff and sticking them in your head. How do you stick them? You stick them through questions and you stick them through Anki. So the first thing you need to do is to bring a spreadsheet of Excel, and you take the run times of all the videos you need to watch, whether it's Boards and Beyond, Pathoma, and Sketchy, and you need to spread them out over the spreadsheet according to the system you would be doing that week. So a week of cardio, you need to be finished with all the Board and Beyond videos and Pathoma videos related to cardio. And don't forget that every day you should be doing at least one block of UWorld. This is something you cannot sacrifice. Even if you wouldn't watch a video that day, you have to do a random block of UWorld first thing in the morning. After that, you watch the videos of whatever system you planned for the day. Alright guys, and you do that, you keep repeating until you finish all the systems, and Anki along the way for all the videos you've watched. Alright, and you can see here that I've highlighted in green what you highlight in green what you finished, and what you still have yet to finish you highlight in yellow, so that you can actually catch it up later. And you also have catch-up days, things like that. So the first 2 months of your dedicated, or block number 1 of your dedicated, if you're starting from scratch and you haven't watched any video yet, you will be doing UWorld random and timed every morning, and videos and Anki in the rest of the day. Your second block, which is your final month, assuming your dedicated is 3 months or 3.5, in your final month you will mainly be practicing, since you've already learned the material well. You've learned it well through UWorld and through all these high yield stuff, and so you will mainly be focusing on doing NBMEs and UWorld self-assessments. The point of doing all these practice material is to actually be practicing for the marathon by running a marathon. That's 1, and 2, by identifying your weak topics. Now that you've gone through a pass of material already in your first 2 months, you now need to know what topics you should really be focusing on very well. These topics will be the ones you will be that you would be scoring bad in the NBMEs and in the UWorld self-assessments. You get a report with your weak areas. These are the areas you should be focusing on in the end, because you don't want to be asked a question in your weak area. You need to strengthen them so that all you have is strengths and no weaknesses. So this is the point of doing more questions or more practice tests, by identifying your weak points and working on them. The second thing is that everything highly tested on NBMEs is highly tested on the real deal. There is a kind of a list with the 100 highly tested concepts, and this is true. It is also highly tested on the real deal. Now, you notice that I haven't mentioned first aid as of yet, because this is an encyclopedia. You don't start studying by looking up an encyclopedia. And so this is not the best way to start your dedicated. Here is where first aid comes in handy. When you're actually doing practice tests and you want to review your weak points, you're not going to keep going back to videos. This is when you can flip through first aid. And I want to reassure you guys, it's okay if you don't finish it. I did not finish first aid going into the test, and it turned out fine. First aid is only it's only beneficial if you've actually reviewed it before, and this is your second time, or you actually have a good grasp of things, and just for a final review. So it should only act as a final review. This should not be your primary resource if you're starting out yet. Finally, guys, I wanna give you some lifestyle tips that you need to avoid the burnout. In the final month, you will be burned out, and it's not good. It's not good to feel like not studying when your exam is in a month or in 2 weeks even. What I suggest is to exercise every day. I even did push-ups in the morning of my test. Some people actually have this joke that whenever you do a wrong UWorld question, you go on and do push-ups. Looks like we're all gonna be fit after that. So yeah, exercise relieves a lot of stress. And number two, don't worry if you are taking a lot of breaks, or if your family goes on vacation and you have to go with them or things like that. This happened to me, and I still managed. As long as you try to fit in some Anki, like anything in the middle, there is gonna be a lot of disturbances to your dedicated period if you have a big family and they go on visits, things like that. So it's okay to take a break. Now I'm gonna list down the most high yield topics that came on my test so that you can review them in your final week. The number one most high yield topic to review is immunology. You need to know this like the back of your hand. Any resource you want, BNB, first aid, but you need to memorize all the immunodeficiencies, all the interactions of CD4 and CD8, the thymus, things like that. Please review immunology in your final week. Number two, reproductive and hormones. Oh my God. Reproductive, you need to know all the images of the female reproductive pathologies. You need to know all the nerves of the male genital system. It's very high yield, and I wasn't strong in this area at all. So please, guys, review that. Why do I say hormones? Because physiology is the second highly tested topic on the test. So you need to know the functions of the hormones, when they come out and when they do not. This was very, very heavily tested. So please make sure you review that. Pathoma chapters 1 to 3 is the gold standard. It will give you free points. I was surprised that actually it was very, very highly tested, and it was very, very easy. Oh my God, just because you read or watched Pathoma chapters 1 to 3, this is not hyped up. This is real, guys. And I reviewed Pathoma Hemonc the night of the test, and I don't regret it because, guys, there is a lot of chromosomal translocations, things like that, that are memorization heavy and that you need to keep fresh in your head before going into the test. Finally, Boards and Beyond Renal. I do not regret rewatching that in my final week. Renal and electrolytes is a very high yield topic. Make sure you master that. And what Dr. Ryan says in this particular topic is very high yield. Finally, on test day, you need to bring the most important thing you need to bring on your test day, even before your scheduling permit, is your passport. Sometimes they don't look at your scheduling permit actually, but yeah, bring your passport, bring your scheduling permit, and I had eggs for breakfast, but you need to know what you should bring in your backpack. That's what you would be munching on in breaks. So I got a thermos full of espresso. You need to keep the caffeine up. Also got dark chocolate, Ritter Sport 74%. It will not give you a sugar rush. It will give you the right amount of sugar, and at the same time it helps you concentrate. Actually, the block after I munched on some of this, I actually felt that I did well on that block more than any other. Also pack in some dates with nuts. You will not feel hungry at all, actually. I didn't finish all this food. But yeah, most importantly, the coffee and the chocolate, even more than the dates and nuts, okay? Now, in COVID times, you have to wear a mask while taking the test, and it's annoying. It's very annoying. I brought this 3M mask with a filter, but they actually took it away from me. They did not allow me to wear this mask. You have to wear the surgical mask because they think that this would probably give you more advantage. I'm not sure why they actually took it away from me. But make sure you get the surgical one, not the 3M filter. And do not put your mask below your nose. I did that. I have chronic sinusitis, and it was very hard for me to stay for 8 hours with a mask on. But they warned me twice that they can end my test if I keep putting it below my nose. So make sure, guys, do not risk that. That's why I take frequent breaks in order to breathe. But you really cannot sacrifice your career by putting the mask down. My final thoughts for you guys is that crap happens. You can get sick during your dedicated. I got sick and I lost weight. I couldn't study. You know that I have chronic sinusitis, and there doesn't pass a day without taking NSAIDs and antihistamines. So if I did that, you can do it too. Like, please do not compare yourself to others. Please do not compare your scores to others. I used to compare my UWorld percentage to many others, and I found it very low in comparison, and I freaked out. But you don't know when this person started doing it. Maybe most people start doing it after they've already matured Zanki, and I started it before that, or I didn't even do Zanki. So it's okay as long as you're improving with your scores. Do not compare your performance to others. Even if you are in your dedicated and other people are on vacation, and you might feel that you're sacrificing a lot, but it's worth it in the end. You can see here that it's worth it. All right, guys. So trust yourself and your abilities, and believe that you can do it. And all the best to you guys.